Thank you very much. Okay, so this whole day so far we've talked about, and you guys seen some things about special needs that I know, because I was right there with you, that we were underserving this population, and we had no idea that they even existed in our communities. So basically what happened was, prior to the start of life, if nobody knows, the first thing that we're responsible for as paramedics and EMS professionals is detection. So that's what we're talking about, is detecting who in our community, our demographic, and how are we going to serve that whole population, not the 80%, but 100% of that population. Okay, so that's what we're here for. So in 2004, I had a chance meeting with a mom at a Kroger. Everybody goes shopping for food. Sometimes we get criticized because the fire truck is sitting in there and people want to know why. We work 24 hours. We have to buy the food. But the other thing is that we have the opportunity to have a conversation. In this conversation, the mom basically said, my son has this rare disease, and he's on this special diet, and went into the whole thing and explained that if our normal treatments, he basically had seizure disorders, but he was on a ketogenic diet and could not have any carbohydrates. So he's on a high fat. Well, everybody knows that the first thing that a child does when he seizes is burn his glucose. You do a D-stick, it's low. The first thing you do is give sugar. We could potentially kill him. Okay? So basically we immediately changed our protocol specifically to him, allowing us to have a tailored response to that family and addressed it appropriately so she could rest easy that we knew what was going on. Well, then we asked who else in the township, who else do we respond to has those problems. So we set our people out to look for it when we went out on runs or start asking questions. We have ventilator-dependent children. You just have seen it here. We have 2 or 3 of them now that have different types of ventilators that we have to know how to take them apart in a rapid format so the family knows that we are urgently taking care of those children appropriately. Osteogenesis imperfecta, the brittle bone disease. Imagine Kitty harassed me for being the big brawny guy. Imagine 6 of us walking in, a dad's playing with his child that has OI. They get hurt, and the first thing we do is accuse that dad of child abuse because we didn't know. Well, we didn't know what that disease was. We just know that a child's on the ground hurt and for unknown reason but has a broken leg. So that's not right. Morbidly obese, wheelchair, hospital, bedbound, especially for the fire departments who are doing searches at 2 o'clock in the morning to clear that house. Imagine coming up to somebody who's cancer-ridden, who's at home in a hospital bed, and now you need the manpower. You didn't need it 10 minutes ago. You need it right now. Okay? So we developed a response for all those that we found. In the first registry, what we did, we found a form online. It was entitled Special Needs, and it was through the pediatric surgeons, and it was basically a form that we used. We filled it out, and we shared that with our EMS personnel. We had to keep it secured the best we could in our trucks. We had an EMS supervisor, and we also stored it PDF electronically in the station in the event we had to pull it out. And then the other thing that had to happen was the EMS at 2 o'clock in the morning had to recall that by memory. Well, at 2 o'clock in the morning, you're fuzzy, and you just can't remember that kind of stuff until it's too late. You're there, and you're already behind the 8 ball. Okay? And there's the form. That's what it basically looked like. It's still on the internet. And here's an example of something to start. It's the barbaric form that I call it now, but that's what we started with. The training. CAM programs versus specific training. I'm here to say I'm the EMS coordinator, and I'm responsible for all EMS training in our division. I would rather 100% win-win situation provide specific training to somebody about the community than provide a canned ACLS program. How many people have gone through ACLS every 2 years for the last 20 years? But the minute you get specific training about somebody living in your community, every paramedic sitting in that room is glued to the screen and wanting to know. Myself, our medical director, provides it. Guess what? Doctors don't know everything. He even admits it. I have no idea, so you got to find the experts. So we reach out to Nationwide Children's Hospital for the little ones. The specialty groups, Epilepsy Foundation, or any other of those are very willing to help us provide that training to teach those people appropriately. The number one thing, and the moms supported that 100%, is parent involvement. I can tell you we have one child, the parents came in, met everybody, and to be honest with you, there was not you could hear a pin drop. And they have no medical knowledge, but they were well versed in what that child needed. And to this day, we walk into a house, we're not listening to anybody except that parent, because they know what their child needs. Okay, so 2005, disaster preparedness. This was a lot of the databases were out there for disaster preparedness, and in Hurricane Katrina, 1,800 people died, and overwhelmingly the people that died were people with special needs or needed that extra assistance, and public safety failed them. Nationally, it gave us a black eye. So we brought that back to look at developing what can we do for our community. Delaware County, Ohio, is fastest growing in the state even today. We have a population of 174,214. And in 2008, the Behavioral Risk Factor Surveillance System identified Ohio with 22.7% people with disabilities. So if you equate that, that's almost 40,000 people in our county that has some type of disability. Okay? Prior to that, we were underserving them. We had no idea what was going on or how to take care of them. 2009, 2010, from 05 to 09, it took me those many years to get the right ears to hear what we're trying to do, to get the win-win, the buy-in, all that stuff. But in 2009, after people hearing of the changes that we were doing internally, people finally listened. We built a coalition of experts. So Sherry mentioned that it's me. It's not me. Here's who's played a part of it. Delco Information Technologies, those computer guys. County EMA, my department, Powell Police, Delaware County EMS, the county prosecutor. Nobody likes attorneys, but man, did he help us out. He was a thorn in my side, and I'll explain when we get to that part, but he helped us out immensely. Delaware County Board of Department of Disabilities, and a special needs mom, the original lady that I talked to at the Kroger, came to be a very important factor to what we did, because before being a mom, she worked for a gentleman and did national research. So she participated in what we did. The national research, we actually back in when we started this, looked at Rhode Island, North Carolina, Florida, Texas, and Utah. Now, if you go and look at special needs databases, they're all over the place. But what we did at the time was we took best practices from all the sites, and we tweaked two key areas. One, email verification. And what happened was somebody registers, but then 6 months they move away. Our guys could be still responding to them, thinking that we're going on a child with OI, and all of a sudden it's a whole new family. That doesn't make us look good. We need to know. So what happens is we can manually push out an email so they have to log in. If somebody doesn't log in to verify in 10 days, it comes back to my office, and then we can address it. The other thing is what we added was the medical specialty. All the research was showing for disaster preparedness only, nothing for medical specialties. So we tweaked it and we increased that, and our guys are better medics for it. The things that we learn on a daily basis, they can take out into the streets and use their analytical skills. And I'll be honest with you, we have Columbus Zoo, 2 million visitors. And you can go there almost every day of the week and see a bus that has some type of disabilities on there. We don't know anything about them, but we're still responsible for them. And our medics now, because of this training, are more comfortable and able to use those skills to evaluate those children or those adults appropriately. So who's on this registry? People with medications, disaster preparedness. Feds have come out and now say that the shelters have to be both medically and equipped to handle the people that don't need any medical surveillance together. Sight, hearing, speech impairments, ventilator dependent, oxygen use. How many times do we see a house explode? It's caught on fire in southern Ohio. We had a house explode. If we don't know that that's there, we're inundating a house with firemen that could potentially get hurt. Medical equipment, again, the ventilator. How do you take that apart very quickly? Mobility issues, again, we just have to inundate a house because it's on fire. They have mobility concerns. We just go in there and know what we're doing. Mental conditions, again, autism. Shut the lights and siren off before you get there. Simple, simple, simple. Okay. Service animals, how do you deal with them? We address that in protocols. Language barriers. We have a lot of people that speak Spanish. We have some Somali populations. And again, being treated by a medical specialist. If they are, we want to know about it. We developed a web-based version that would allow the public safety access to this data. So it's a secured site, so there's, unless you got a really good hacker, it's going to be a secured site. The ability to verify active status, so it's that email stuff. We have older populations that, I don't use email. Well, we address that. It's either a family member or they have a caseworker, the Department of Counsel for Older Adults. Their caseworkers will actually set up a email, so they're a part of that now. So everybody is in there. The information that we put in that is directly to our dispatch center. So that immediately you call 911 and you're on this registry, that dispatcher will see that information. Also, the registrant is able to update and change information as needed. Change the medication, cell phone numbers, persons of contacts, whatever that is on that page, they have that login and password that they created and they can change it as needed. Then we tested it. We basically took a handful and we manipulated the data to pull it. And in February 8th, 2010, by proclamation of the Delaware County Commissioners, it went live for the whole county. There's 14 jurisdictions in the county, and we're all working in unison off of this system. The registration process can be a little cumbersome, but we streamlined it. But basically, the resident is identified, and it's a voluntary program. If they don't want to be on it, they don't have to be. We have a couple already. Your government, I'm not telling you anything. Okay. But we're still kind of responsible for them. We try to persuade them to let us know. If they don't, we have to respect that. Here's where the prosecutors came in HIPAA form. A lot of the databases did not worry about HIPAA. Because we have the medical specialty stuff, we included that. So that is just one of the cumbersome things that we have to address. The family signs it, we keep it on file, and we're good to go. And then we can share it with other agencies, the Red Cross, the Health Department, and you'll see in future slides why that is. Home visits take place. So 14 jurisdictions. We have a liaison from each fire department or EMS agency. Department of Disabilities and Counsel for Older Adults came in a little later, but they're trained, so now they can go out and do the registration process. So it's not just 2 or 3 people doing it. It's 14 jurisdictions that are working together to get this done. www.delcospecialneeds.com is the website. It's secured and password protected. Again, creates the page. And the email is also for future communications. HIPAA, again, the prosecutor, like I said. And then the department responsibilities. Okay, so let's say Liberty Township. I get somebody who lives in my township aware. It comes to me, and then basically we do the registration, and then it's my responsibility to train my people. Depending upon the situation, because of our mutual aid and automatic response, we'll share that with our first due mutual aid companies. And then because of technology, and I'll show you in a little bit, that we're able to share that information across the county lines. Since the start, we have over 500 registrants on the database. Senate Bill 129 was passed for everybody else to use, and basically that's the cell phone tax. It allows up to $25,000 to be used to create software or hardware to be purchased to develop a registry similar to ours. The database was officially used with remnants of Hurricane Ike. We had the huge windstorm. We worked with AEP, a couple ventilator dependent children, and we got that grid back up first before anybody else. And then Prospect, Ohio is notorious for flooding, and we have a special needs home up there that we had to work with the flooding. And then we recently established a position in our EOC that is a special needs liaison specific. So if something happens, there's someone assigned to address specific special needs in itself. We identified improvement to the website. So anytime there's a problem, somebody has a suggestion, it's a living, breathing document. So we own it, we designed it, we created it, so we know how to go in there, manipulate it, make it better. Software changes to improve the product. We teamed up with the GS Map Room, and I'll show you some of that stuff. Project Lifesaver, our Delaware County Sheriff with autism, Alzheimer's, dementia, and some of the younger children like to abscond from home. If they meet the criteria, they basically go on to they get a wristband, and if they take off, the sheriff can go out and try to find them. And then recently, the most recent was Department of Public Safety Division of EMS. You can go to their website, and there's actually a special needs link now, a resource page for everybody in the audience to pull. There's information just like some of the stuff here. We're looking at videotaping all these speakers. We're going to import it onto their website so everybody can have that information at their fingertips. Field use. Here's the technology. 14 jurisdictions. Anybody use MECMAP around here? Okay, so MECMAP is one, which is awesome in itself. Alerts is our dispatch center, what they use. The web-based search, and again, our dispatchers at a last resort can pull that information and use it accordingly. They're too busy, we try to avoid that. Here's our MECMAP. So basically, you plug in an address, and up on the left-hand corner, it alerts to the gentleman that it's a special needs patient, and then they just hit the target map, and that will pop up. And it's a template, and it basically is the person's name. It'll give the address, date of birth, baseline medical assessment, if there's any EMS or fire warnings. So oxygen's in the basement, or shut off lights and sirens when approaching. That's the kind of stuff that you look there. We actually got a grant, and we provide Knox boxes for those mobility impaired people. That we can just give them a Knox box, and we can make entry without breaking down their door. If they have an animal, is it an ADA animal, or is it just a mean wolf? You just never know. And then you go to the door and it's a little chihuahua. But again, you just never know. And then, and I'm not the IT guy, so forgive me, but we created an FTP site. Anybody know what that means?
Something protocol.
Yes, you're right. But anyways, what is it? Okay, yes. So basically what happens is Orange Township is our next door neighbor. They go to we upload it, they can go to it and download it. So whatever we have in our MECMAP, they can have it. So we have pre-plans of schools, we have the special needs stuff as well. So basically that's it. Here's the alert software. And basically the dispatcher, law enforcement cruisers, anybody with that software, Delaware County EMS, can have access to that. So basically the stream pops up, they would just pop over here to alerts, and then again it goes into this box, and whatever we as the registration person puts in the box will pop up exactly there. So again, we're the trained eye. We walk into their home, we see things that they might not even know that it's important to us. We can put it in there, and then we know prior to coming to the house that it's actually exists and what we're doing. The web-based, this is actually the site itself. We have a search area, and basically we can go in there and search by name, address, zip code. We can do advanced search, and if I want to know how many ventilators are in Delaware County, I can cross-reference that as well. Okay. This is what the registration form looks like, and yes, I'm on there. I'm one. I need the extra assistance at times too. So basically that's theirs, and we can go in there, and they can go in there and change that information. And then here is where we talk about this is huge. I'll be honest with you, before we got this started, never knew how many children in Liberty Township has autism, and the things that we as professionals responding can do to decrease the chances of them having a hard time dealing with us. If we have 3 people in a truck, one's a female, sometimes we have some kids that won't listen to guys or don't want them. We'll send the girl in alone, and she just reduces that stress level. Project Lifesaver I talked about. If you don't know about it, it's basically a national thing, and to this day, over 2,500 rescues, all of them that have been on this program that took off are alive because of it, and we're now a part of it. Disaster preparedness, again, flooding, wind, tornado, hazmat release, power outages, snow emergencies, catastrophic events that we can't think of is all within this and the people that's on the registry. Here's the cool part, the technology, and I am so lucky to have an internationally awarded GIS leader because what you'll see here is that's Delaware County. All the gold dots is everybody who is registered as a special needs person. All the crosses are the shelters. So as a responder, as a supervisor, on my computer, I can pull this up and within minutes of an incident see what's going on and start working that situation. This basically, same thing, but it shows me the power grids, the power lines, so I know what power company I'm working with and where do I need to start asking them to work with it to put it back up. This one here is they can do a flood inundation plan. And basically everything in this blue, anything in between that would be flooded out. Okay? So if you see right here are all the homes that would be flooded, and those are the special needs homes as well. So if we know the Army Corps of Engineers, it's been raining for 3 days, and we know that it's potentially going to flood, we can initiate this plan. Army Corps of Engineers says at 14.7 feet, it's going to do this. They throw the map up. We put the special needs layer. We can evacuate those people before it even happens. And how that happens is at the bottom, it actually creates an Excel spreadsheet of all those homes for us. Okay. Here's a hazmat situation. If we go into a rail car incident and it's leaking, I use my ERG book, and it tells me that the methyl ethyl badge stuff is needs a 5,000 foot cordon for the hot zone. I just come up in the upper right hand corner, place 5,000 feet, hit the special needs, and then it works it, uses a circle, and again identifies all those places. And then creates the Excel spreadsheet at the bottom. And one thing I want to point out that's very important is there's 2 shelters in that cordon that I know immediately I can't use. Okay? So why is this helpful? Emergency response, public safety will be aware. Again, it's detection, it's awareness, ability to have the knowledge not to be behind the 8 ball. We're trained, and as Kitty has said in the past, we're basically the preferred responders. We're prepared to take care of that situation. Again, our medics respond to the zoo on a daily basis in the summertime, and they're prepared to take care of those people that have those special needs. We provide a professional, knowledgeable, and compassionate response, not just to the patient, but to the entire family, to include that mom. So when we show up with 6 guys, one of those guys is going to the mom and pulling her aside to get that information going, so that they know that. Also, disaster preparedness. We develop plans. We work with the Red Cross. We work with Health Department, the EMA office to develop those plans for disaster and how we're going to do it. It's assist public safety. So on that scene, we can see what happens. And then again, we establish equipment and supplies. So in the event we know that's something's going to happen, because we know the demographic, we know what to expect. Any questions?
How do people find out about it? How do they know it exists?
Well, and this is only in Delaware County right now. But the way we've done it, a couple things. Word of mouth by public safety. We've also done some marketing by putting out flyers and pamphlets. The Department of Disability, Council for Older Adults has been our advocates. And one of the, I call her the charter members, she passed away recently. And in lieu of flowers, because we've been there numerous times and how it changed them, where they could actually go out for a while and know that they were protected with knowledgeable people. In lieu of flowers, they asked for donations to come into the special needs stuff. So that money became available. We created marketing stuff for it to get it out there. Yes, Kitty?
Well, I know that this is for special needs in Delaware County, and I keep beating the drum in Hamilton County, Cincinnati area. How easily would this system transfer to other counties within Ohio?
Well, I'll be honest with you. I think each agency has to look at their demographic. How many people are they dealing with? The city of Columbus has 1.2 million people. That's pretty cumbersome to take on, to be this aggressive, okay? But at the same time, where there's a will, there's a way. To be knowledgeable, to be aware. Delaware County, everybody that sits on the board, we have Tuscaroras County and Fairfield County coming out next week, and we're willing to share whatever they want, even if it's that program. Now, our program might be speaking Spanish while they need to convert it over to French, but at the same time, there's people that can do that.
And I would think that with various volunteer groups like CERT and Medical Reserve Corps, it would seem that some of those people might be able to, that this would be something that perhaps they could get involved with.
Yeah, at this point in time, we don't have them involved, but they're aware of the program, and I think we've been successful enough to get that word out that we haven't had to reach out to them. But that's what's nice about this program too, is since we've established it, that cohesive working relationship has enhanced 100-fold because of reaching out to all these other agencies and to get this information out there.
In addition to collecting the information, it sounds as if you do some outreach. So crews, squads actually go out in non-emergency situations to become acquainted. Is that?
It all depends upon the situation. If I have a mobility impaired person who's in a wheelchair, it's not necessarily we don't necessarily go out and they meet the crews, okay? But if we have a child with a ventilator problem, 9 times out of 10, we're going to bring them to the firehouse, and we have 54 medics. They're going to meet all 54. So it's a case-by-case scenario how we do that, okay? But, and let me say that somebody from our department is going to know them. So I'm usually the one. So if I show up, they have that one-on-one contact already, so that already reduces the stress level if I show up. Yes, Kitty?
Almost sounds like the special needs registry, correct me if I'm wrong, but it sounds like this is the type of thing that communities could use as their accommodation policy or part of their accommodation policy for dealing with people with special needs or even functional needs. And that, I know that was something that Marilyn and I had talked about. Is that?
I agree with you. I'm sitting on the Franklin County Functional Needs Task Force. The feds have come out and have said that communities have to have a functional needs capacity. So that legislation has come out. They're working on it. But again, Franklin County, 1.2 million people. That's a lot of people to be coming up with a plan to take care of everybody. But they're working on it. And I'm sure other people are too. Yes, sir.
You are a municipal service provider, right?
We're a township. Yes.
It's government agency.
Yes.
Do you incorporate private service providers into this system to allow them access to it?
If there was a private company that was in our jurisdiction that was doing responses, yes.
Doesn't Delaware County have any private service?
No.
Really?
They do for transfers from hospital to hospital, but no private service to for 911 calls.
Well, even at that, some of these private services are going to provide transportation for a patient from home to a hospital, home to a doctor's office.
Sure.
I've encountered that a few times. That the type of information that you have would, from my perspective, be very valuable.
And I agree with you, and that's what that HIPAA form is for. So if we, and again, I don't know, I couldn't tell you how many times a private agency comes into my township to transfer somebody. But if they came to me and said, hey, we heard about this program and can we have access to it, we already have the HIPAA form signed. So if they can show a need, we're more than welcoming to have them a part of that. I just don't know that exists in our county. Okay. Any other questions? Okay. We have two scenarios that we want to talk about. Kitty, you want to start with yours?
Is the part of the program where you get a chance to apply everything that we've hit you up with this morning. And I know that, and this afternoon, we've hit you up with a lot of stuff. There's a lot of things to think about. And I know for me, sometimes it just gets a little overwhelming. How do I put it all together? But a couple questions and talking with everyone can sort of help put it together and give you a chance to apply it. So that's what this part of the program is about. We have two different scenarios, and the first one we're going to start with, and this is actually based on a real event, but the names and places have been changed to protect the innocent. Please?
Are there any innocents?
And maybe. So our gentleman that we're looking at here is Bob. You see why I've protected his innocence. Bob is a 70-year-old gentleman, and he has a hearing disability, and he also is visually impaired. In fact, he's totally blind, we'll say. He travels with a guide dog who helps mitigate or helps him navigate his environment. He uses hearing aids, and with those hearing aids, he's actually able to hear pretty well. Without the hearing aids, all bets are off. Sometimes Bob doesn't realize that the batteries are going dead in his hearing aid. And sometimes he might even forget to turn them on. But like I say, when they're in and their batteries are fully charged, everything is good. Bob is walking down the street
on his way to the grocery store, crossing a light-controlled intersection. A car hits him. When you arrive on scene, you find Bob lying in the street. His left arm is bleeding severely. His right leg is extremely swollen and looks like it is in a position that most normal legs would not be able to get into. He is crying, actually more like shouting out, because it sounds like he is giving screams of pain. His dog is close by his left side. What would you do to help Bob? Would you take him in your ambulance? How would you identify yourself to Bob to make sure that he knows who you are? How would you work with him, and what would you do with his dog? And it's all open for discussion. Bill is going to sort of help call attention to people that are raising their hands or whatever, since you guys could hold your hand up all day, and I'd never know.
Is it a service dog? Or just
It's his guide dog.
his guide?
So yes, it is a service dog. Because his dog helps him navigate the environment. That's the task that the dog is trained to do.
Well, the first thing you do is you, when you get on the scene, is make sure traffic is controlled where it's safe for you to even try to talk to Bob.
Okay. Yeah, that's a good point. You know, set up some barriers, do something so you can be able to get to Bob. And then once you get there, I mean, here the poor man is. He's laying in the street. Looks like he's tried to get to the sidewalk, but he can't.
The impact might have knocked his hearing aids out.
Okay.
Make sure he can hear you and answer questions.
How are you going to find out if he can hear you?
First of all, you just try talking to him in normal voice, see if he responds.
All right.
If he doesn't, try to make sure you're in his line of vision, not vision. Try raising your voice a little bit, see if he gives you some kind of recognition. And if not, then you're just going to have to touch him very gently and try to convey that you're trying to help him.
Okay.
Don't ask me how to do that, because I'd have to work on that.
Okay. Can someone else help her? How would you? Bill, what would you? Oh, go ahead.
It's nice that he's trying to get through to him, but it sounds like he's pretty jacked up. He needs to be dealt with, and he needs to be dealt with now. And if you can talk to him, great. If not, you're going to have to do what you got to do. And that means split his leg and get him onto a cot, get him in the back of the ambulance, and then start trying to talk to him.
Good
At that
point.
point.
Okay, but you know what? Think about, remember the experience I was sharing with you this morning about how does that person, what do they know about what you're going to do? And if you start doing things and the person doesn't know what you're doing, you can really exacerbate a problem. Not to mention, you don't have any informed consent from him, right?
Well, we really don't need to be informed consent as long as if he's not responding to us. We can use implied consent for one. For two, he's in a dangerous situation. We need to get him out of that situation.
Okay, I can totally see where you're coming from.
Basically, you're the follow me person at that point, so they may not trust you. They don't know who you are.
Right.
Get him safe and then talk to him.
Bump the siren so they can hear it.
Marguerite?
I might identify, can he touch my face? Can he read my lips with his hands at all? And the calming, use my voice. If I've got on identification, I might let him feel that I've got on identification with a badge, something on my uniform, something he can feel, tactile stimulation. Let him know I'm there to help. If I can get him to hear me, find out if he's got his hearing aid in his pocket or whatever, try to apply that, talk to him really calmly and say what I'm going to do. I'd also address the dog. I mean, the dog is going to need to know I'm there to help. I need to lay a hand on the dog and at least let it know that I'm trying to help him as well.
Might there be a chance that he has a sighting companion with him?
that we could ask questions of?
This time that would be good if he did, but he doesn't. And I specifically did that because I know that if a sighted companion is there, that's the easiest way to work.
Yeah.
But gosh, I can't tell you the number of people with disabilities that go and do things independently just like you. And so no, he doesn't have anyone with him. And one thing I will mention about being able to touch someone's face, were you thinking that if he touched your face, that would matter, that would help him?
No, but I have had a patient that was able to actually, when I was talking to them, or actually he couldn't see me, but he was actually able to read lips tactile. He had worked on that, was able, and I don't know why he had graphically worked with that with a person, but he was actually able to touch a face and realize somewhat what they were saying, their tone of voice, and pick up with sensation that they were there to help. It was a patient that I had in the emergency room.
Wow.
People that are deaf and blind do tend to do a lot through touch that way.
But it's usually not touching the
lip
lips.
No, it's not lip reading. I don't know what else to call that, though.
It's, well, what they do is there is tactual signing that they do in their hands.
Sure.
Finger spelling, drawing the shape of letters.
Braille boards.
Well, sometimes a deaf-blind person might have a tactile communication device with them, and where it's Braille and print for you on your end or whatever. So if he had that, that would certainly help. Whether he has that, I'm not sure. I know what you're saying in terms of, okay, we got to get him out of the street, and
well, okay, let's change the situation. What if he's in a house that's on fire? Am I going to try to get through to him, or am I going to grab him and take him out of the house? I'm going to grab him and take him out of the house. I'm not going to try to talk to him.
you know what? Someone actually said that to me once, and this person was a firefighter. In fact, he did forest fires. And he said, if there's a fire, I'm getting the person out and we can figure it out later. And I said to him, and I will say this to you, if the person's unconscious, okay. But if you come up and grab me and start to pull me out or pull me somewhere, I don't know who you are. I promise I'm not going with you. I will bend my knees so far down that I'm not going to go because I don't know who you are and what your intent is. So you need to take that step of calming down. As Bill said, do step 1 before you get to step 2. If I'm blind, and actually I am, and you know, or anyone that you came to rescue in a fire, you got to quickly tell us what's going on.
All right, I'll take 10 seconds to do that. Then we're good.
Because otherwise I'm not going to cooperate with you.
Actually, you're doing it at the same time that you're trying to help them. You're talking to them as you're doing.
Yeah.
That way, you're not wasting time out there on the scene to make sure they're safe.
Mm-hmm. Yeah, I think you're absolutely right. Where we're trying to go with this scenario is to make everybody aware that taking that extra 10 seconds to address the concerns of making sure that they're comfortable in understanding what you're doing with, and to address what are we going to do with the dog. And again, you heard today that is a law that we have to address. I got medics that have told me that I'm not taking that dog. Well, yeah, you are. We're going to go. Yes.
And there was actually, I'm sorry.
Hang on.
There was actually a case in Baltimore where it was a veteran. He and his guide dog were walking to participate in the Veterans Day parade, and he actually was struck by a car. The medics showed up, absolutely refused to treat him. To take the guide dog, I'm sorry. They were willing to treat him, but they were absolutely, under no circumstances, willing to transport the guide dog. The police officer who was there said, well, you can't leave the dog just loose on the street. If you don't transport it, then the dog goes to the animal shelter. Yeah. Since then, let's just say that their accommodation policy in Baltimore has changed.
Marilyn?
Yeah, I just want everyone, and this is something Kitty has taught me, so have you thought about if you're willing to take the dog, what are you going to do to ensure that the dog is safe in the ambulance? That it's secure, it wouldn't be thrown as a result of a sudden stop? Do you have the capacity or the equipment that would allow you to do that?
We have a problem with our own people. I'm not secure in the back of a medic. So that right.
Well, I'm just wondering if you think about where you would hook a leash, or if you would think about there are car seats for dogs, that this would be equipment you'd have available.
That's something that I never thought about. Sure.
I think at this point, we, as service dog users, would be happy if the dog goes along. I mean, it'd be ideal if the dog could be seat belted with a restraint system, but at this point, if the dog can just be there, that's a huge step forward.
And is there some kind of a hook in the ambulance? I actually had my first ambulance tour in preparing for this program. And I found that there was a railing that went down to the side door of an ambulance. Some. And I realize not all of them. But my point is there some kind of hook? Is there some kind of railing? Is there something?
I think most medics, there's something that can be tied off on.
Would not we still be compliant if we have a critical patient that's injured that has a service dog, and we take the patient, and at least in our area, we can say to the deputy sheriff, we need to go now. Will you bring this dog to the emergency facility? And in our area, our deputy sheriff is going to say yes.
I think that's a very
we're still compliant. We're getting the dog,
that's a viable.
But we're not spending 2 minutes or
Sure,
3 minutes.
that's viable.
I mean, that seems to be a viable thing if you have a critical situation.
Just don't leave the dog alone. And again, part of it is also you got to ask that patient. If the patient's conscious, get that patient's permission. Don't just say, "Oh, we got to go," and meanwhile the patient's thinking, "Where's my dog? Where's my dog?" Because remember, Portia's an extension of my eyes. She's a part of me. I got to know what's happening to her, much like a parent would want to know what's going to happen to their child if the parent is the one being transported. So make sure that it gets back to communication and avoid assuming, ask.
Okay. Yes, ma'am.
What would you do if the gentleman that's the pedestrian was very injured like that? And also, what's the chances of his service dog having some severe injuries? What would you do then? If the service dog was also fairly severely injured and also his individual, what would you do?
Again, it's going to depend a lot on your community's accommodation policy. If you can get the patient to understand that there's something wrong with the dog, it might be that the patient says, "Yeah, take my dog to the emergency vet." I know that the policy in Baltimore actually has a provision where if a service animal is hurt, they call to a special emergency vet number and bring the animal in. The animal's treated, the vet keeps the animal until the animal and the patient can be reunited.
Good.
Does the individual or the owner carry like emergency, like vet information if the animal would be severely injured, that they could get that animal, emergency care also, as well as his owner?
It's a good idea. I can't say that everybody carries that information. I've actually been meaning to put it on my dog, and I haven't yet. So if a person does have it, that's more of a way that a dog handler can take responsibility for what happens with their animal. But if not, it's something that your local EMS group, when you're putting together your policy and your procedures, it might be worth getting a memorandum of understanding or something with your local vet.
If I can interject, some of the dogs, their uniforms, their harnesses actually have a pouch on them. They'll have a zippered pouch, or the dog may have a backpack with pouches on it. If that's the case, if it looks at all like there might be a compartment on the dog, check it, because a good chance is there's going to be emergency contact information or emergency medical information for the person in that couch. Because I know a lot of users do put that information on their dog, not only for the dog but for themselves as well.
Any other comments on that scenario? Yes, sir.
Back to Bob. If we come up on him, if we don't know him, we don't know what impairments he has.
Right.
So as we try to address him, if he's not responding, we don't know if it's because of the accident or because of a pre-existing condition. So if he does not respond, we can't, either because he can't hear or he's incapacitated.
I think you're absolutely right. All we're trying to do is just make sure that you're aware that that's a potential.
One of the first things you want to do is do a quick, if you see the service dog or any patient, do a quick scan for medic alert tag.
Right.
Yeah.
Maybe there's a bracelet or something around the neck that says, hey, I'm visually impaired or hearing impaired. Something that'll give you a...
The guide dogs are pretty, their equipment is very specific. You're going to see a rigid handle that extends long enough for the person to hold while the dog is standing next to them. Now, of course, depending on the size of the dog, that handle length is going to vary, but typically for the guide dog, it's going to have a rigid handle. So if you come across a situation where the person is unresponsive or you're not sure what's going on, and they have that type of a harness, there's probably a good chance they have a vision impairment. But the other harnesses, who knows what could be the problem.
This is the handle that Portia has.
Now you got to step out to
okay.
a little bit more, about 3 more feet. There you go.
Okay, this is the handle that Portia's wearing, her harness. I'm holding her handle, and come back here. And this is her leash. So you'll typically see a handle or a harness, something like this. Some of the harnesses actually have the school's name where the dog was trained. Now, if the harness gets mangled in the accident, you still might see remnants of it.
Okay.
Most major areas do have an emergency 24-hour vet.
Right there.
So, since the major cities, Cincinnati and Columbus and Cleveland and those. What was that?
South of Interstate 70 is a whole other world.
Yeah, we live in another world.
Yeah. Well, I know that Cincinnati has 2 actually, but you may want to become familiar with that. And sometimes it's not a specific emergency vet clinic that's set up as an emergency clinic, but sometimes if you look through the phone book at the vets that are in the area, some of them say 24-hour emergency number, and you call them and it's actually the vet's cell phone, and they'll show up in an emergency.
Here's a perfect point to why we're doing that. Somewhere in your area, there may be somebody that's available that you're not aware of.
Right.
That's why we're here, to elicit that thought process, to reach out to those people, so in the event you do come across it, you can respond appropriately.
Or you may be able to set something up with the veterinarian and say, hey, if the AMTs come across a situation, would you be willing to, help?
Yeah, and I think most vets will.
Yeah, I would think.
Mr. Burdick?
Check with your local EMA office. If they have an animal policy, they will have a listing for a 24-hour vet.
Mm-hmm. Good point. Should, if they're on their game. Okay. Any other points? Okay, you want to stay up here?
Yeah.
Okay. The next one, this is very unique, and the committee shared this scenario, and we thought it would be very appropriate to show you some of the things, just so you're aware that there are things out there in the communities that no one's aware of. So here's the scenario. During a Saturday afternoon shift at your local EMS or fire station, wherever you work, some of the crew are sitting watching television while others are sitting around the table making small talk about what's happening around town. One of your new guys overhears the cops responding over to that house that everybody talks about, but nobody knows who really lives there. And people talk about it being a crack house, or let me see here, or has illegal immigrants in it, or whatever. There's always those rumors about that house. No fire EMS personnel have ever been there, but they're interested and they want to see what's going on, so they're kind of listening. They hear the first patrol car arrive, and moments later hear the officer frantically call for EMS. The alert tones go off announcing the request for your support to the address, and the nature of the call is a young boy having a seizure. Within minutes, EMS personnel arrive and make a quick observation of the house, a single-story structure that appears to have a partial basement. Also notice the yard is unkempt and there's clutter lying around the house and garage. So that's basically what you pull up and see. Okay? You're greeted by the second officer that arrived and stated that the boy was in the back bedroom. Upon entering the house, you make an observation that makes you very concerned about what else they see. A deadbolt that's locking him in the house. Okay? You think that's a problem for fire and EMS people? Okay. Upon entering the house, you make the observation, okay. The doors to the outside have additional deadbolt locks to lock them inside. Windows do not appear to be the typical window. Upon entering a hallway, you notice that the bedroom they are about to enter has an additional deadbolt, but reversed as to lock someone inside the bedroom. And there's that window. It's made of plexiglass. Upon entering the bedroom, they witness the scene. The walls have rubber matting, are secured, and glasses replaced with plexiglass. There's limited furniture in the room, and hanging from the center of the room is a makeshift swing. The patient is found post-ictal on the floor near the swing. Okay? While the boy is being assessed for his ABCs, the lead medic starts to ask the guardian some questions. They find that the guardian is actually a therapist that is helping the child until his parents could return. They went to the local grocery store, pick up some items, They find that he is on seizure meds, bipolar medicine, and the bottle of Strattera, but the therapist thinks that he no longer can take it for increased suicidal thoughts. He also has anger management issues and a personality disorder. This causes a severe decrease in ability to communicate effectively. Suddenly, the EMS personnel voice is raised, and the young boy is now fighting with them, and it takes all of them to subdue him. Fortunately, they have medication, and they chemically sedate him. The message to this story, and I want to show a couple more pictures. There's the boy in the swing. Okay, this is a real live case, and the whole aspect that we're trying to show or teach you guys is that in your communities, it's our responsibility to detect and be aware, so then when we do get that call at 2 o'clock in the morning, that we are about to take care of someone that we're not used to taking care of. We're fighting a fire, trying to get into a house and finding that we have to go through deadbolt locks. The other message that I want to take away with this, and this is one of the things that we learned, was to deal with our law enforcement people. Law enforcement, I'm sure they were aware of them, but they didn't communicate that to us. And you know, they're there for other reasons. They're driving by 24/7. They see more activity and stuff like that. So work with your police, work with your other public agencies.
I was going to try and get you to dim up there, because they really can't see that. You can't.
Oh.
What are those switches over there?
We have other ones over there. We'll just try them all.
Gotcha.
Bingo.
So again, just imagine walking into that with a padded room, and that's just going to throw you off your game, trying to figure out what's going on. And this is living in our community, my county. So again, it's just awareness of what's being out there. Any comments about this scenario? Anything that you would like to mention? Yes, ma'am.
You know, before, if you would go in a house and see, oh my gosh, they've got this lock reversed and they're locking this child in, and you think, oh my gosh, what kind of parent is this? But when you stop and think of all the behavioral, and if he's autistic and all these other, you know, health-related things that child and parents are dealing with, they've got to try to keep him safe some way.
Exactly.
And you know, you don't want him wandering out of the house at night, or whenever he gets up, if parents try to sleep. I mean, you think of it a lot differently when you
Right.
think about
So basically, the parents that were up here, it's a 24/7 job for them. So our job, when we're aware of it, is to assist them when they call us, not be a hindrance. And that's all we're trying to do, is that awareness level.
This child was a runner, correct?
Yes, actually ran away twice.
Yeah. That's what the parents were faced with.
I'm just curious, prior to going through this seminar, how many people would have called Children's Services coming into that situation?
You probably want to.
Oh, yeah.
I would think everybody, without knowing what was going on.
And hopefully they're aware of what's going on.
Yeah, and they are. But yeah, that's why we asked Dr. Butter to comment on this. And if you remember, one of his slides, I think, mentioned, don't be surprised if there's locks on doors and windows, because this was one of his patients. Yeah.
Mm-hmm. Okay. Anything else, Sherry?
No.
Mike, anything?
Does anybody need any bags for anything?
Yeah.